Welcome to part 4 of No Pain, More Gain. Today we're talking about pain management in healthcare. So how does we as physical therapists, and honestly all professionals in healthcare, help with treating pain and helping people get back to their daily life? Well, we've already gone over pain, how it works, and the mechanisms that cause it. But when we're treating pain, it's really important to know what kind of pain they're experiencing. So there's 3 types of pain mechanisms. And they're big long words, but trust me, we'll go more in depth into it. The first one is nociceptive, the second one is peripheral neurogenic, and the third one is central. Okay, so what does that mean? Let's start with nociceptive. Nociceptive is localized pain. Things like pricking my finger, like we talked about. One site of injury where you're getting pain. It's something that we can really see the aggravating factor from it, and it's clear and proportional. So when I pricked my finger, I know what it came from and how to treat it. The second one is peripheral neurogenic. So this has to do with nerves. Things like shocking or shooting pain, for example, like when people have sciatic nerve issues, where they get that tightness, that shooting pain that seems to be off and on but unrelenting. And they'll usually have pain in dermatomal spots, which is just different areas of the skin that correspond to a different nerve root. And then the third one is central mechanisms. Now this is pain that has been exacerbated by the patient's emotions. So they might have disproportionate pain to the injury, where it seems like it's way higher than it should be, and also aggravating and easing factors that are not in line with what the actual injury is. Usually they're going to have pain beliefs, sad behavior, and a poor outlook for their progress. And again, you're able to identify which bucket they fall into through things like the biopsychosocial model. So them falling into one bucket or the other could come from things like their genetics, their thoughts, their feelings, and even their social environment. Once we put their pain in a bucket, we can also tell if it's acute, subacute, or chronic pain, as those will have different time expectancies of healing. And with that knowledge combined, you can provide proper education to your patient, help them with a generalized time frame, as everyone's different, and especially for the central bucket, provide education and usually optimism for their recovery. So what does this tell us? Well, we need to focus on a few things. One, we need to find which bucket they fall into in order to help treat them effectively, which we'll get into more on how we're treating them in the next video. Second, we need to not just look at the mechanism of injury. As we've seen, depending on which bucket they fall into, they could be experiencing pain from something else. And third, which might be the most important, we don't want to make patients feel misunderstood, like it's all in their head and they really shouldn't have any issues. The pain that they're feeling is real from their brain, and our goal is to help them as best as possible to diffuse that pain. So because of that, our education needs to be thought out really well. So let's recap pain management in healthcare. 1, we're going to establish the bucket that they fall into. 2, we're going to establish if it's acute, subacute, or chronic pain. From there, we can educate, complete therapies, establish a prognosis, and help the patient as a whole. It's more than just treat the mechanism of injury, it's treat the person. Go ahead and swipe down to part 5, how a physical therapist evaluates pain. This is a good one.